transplant team is truly multidisciplinary, and colleagues in the team will look after all aspects of your care before, during and after the transplant. The first job they'll have to do is to decide whether transplantation is an appropriate treatment for you and for your disease. They will discuss the process of transplantation and also alternative treatments that you might want to consider. If you decide to go ahead with the transplant and it is deemed appropriate by the medical team, they will help you prepare for the transplant, make sure you're fit enough for it.
We'll have a chat about your current level of mobility, if you've got any problems with your joints or muscles. We'll then issue you with an exercise programme to follow, which will just help to prevent muscle weakness while you're in hospital. We'll come and see you weekly just to progress the exercises and have a chat about energy conservation and how to manage fatigue while you're in hospital.
So we'll be working very closely with the transplant patient, and we provide ongoing support throughout their cancer journey. We'll be helping to coordinate their transplant and making sure that they are ready for collection of the stem cells and their admission to the ward for reinfusion.
We have 2 haematology pharmacists on the ward, and we are responsible for ensuring the safe use of medicines, including chemotherapy, and also to provide advice regarding medicines use for patients.
You will be given advice on following the modified ward diet, and you will also be given advice on maintaining a good nutritional intake, as that will aid your recovery post-transplant.
We are a small nurse practitioner team, and our role involves doing pre-assessment clinics, answering the cancer treatment helpline and giving your stem cells back.
The Friends of Anchor Wellbeing team are based within the unit. They're there to provide wellbeing services such as hair and wig service. We have massage, we have a nail service, and we also offer some podiatry too. We also have some activities available which will keep you occupied. We have some crafts and games as well. These services will all be available to you before and after your time in isolation.
The ward nursing team is made up of nursing staff and healthcare support workers. We'll be looking after you for your duration of your treatment in the ward. We are here 24/7 and your first point of call.
The preparation for transplantation is important on a number of fronts. Firstly, your medical team will make sure that your disease is under control, and that is very important because if your disease is not under control, then you may go through a transplant procedure with less chance of it working. So it's important that you feel comfortable with the decision. It's very important that you feel you've got enough information and you've asked all of the questions and had answers to the questions that you want. And then in the build-up to the transplant, trying to keep us generally as healthy as possible.
So we need to make sure that you've had a number of tests performed before that you come in for your transplant to make sure that your heart and your lungs and your kidneys are strong enough before we start intensive chemotherapy. You may already have a PICC line before you come in, but if you don't, you'll get one on the day of admission to the ward. So the PICC line will be used for giving you your high dose of chemotherapy and also to return your stem cells.
The more active you are before your transplant, the stronger you'll feel at the end of your transplant. We recommend that you bring in some loose, comfortable clothes, some supportive light footwear, and if you want to bring in a Fitbit or a gymnastic ball or any other equipment you use at home, please feel free.
So all the rooms are single rooms with an ensuite. When you're in hospital, you'll be in isolation because your blood counts will be low. Visitors are allowed into the ward, but we try and limit it to 2 visitors at a time. You may feel that you're quite tired as well, so it'll be a good idea to space out your visitors when they come. So for entertainment in the ward, there are TVs in each of the rooms. We also have DVD consoles, Wiis and Xboxes that can be connected to TVs to pass the time. We do encourage you to get up and walk about your room or sit for periods of time to try and have a daily routine. This will help prevent any hospital-acquired infections such as chest infections and also help you psychologically.
When on the ward, you will follow the modified ward diet. This is a diet that eliminates the high-risk foods and drinks while your blood counts are low. Visitors are encouraged not to bring perishable foods into the ward for you, but they can bring in wrapped, sealed goods such as crisps, biscuits, sweets for you to have as additional snacks. You will also be provided with extra snacks on the ward, such as crackers and cheese, pasteurised yogurts and breakfast cereal for your room. If you're beginning to struggle with dietary intake on the ward, then nutritional support will be commenced. Initially, this will be in the form of oral nutritional supplement drinks, but if you continue to struggle taking an oral intake, then we may start feeding you through your PICC line.
The experience of the what we call the conditioning chemotherapy will not be a lot different to chemotherapy that patients have received before for their disease. However, it will be more intensive and therefore the side effects are greater. You're likely to suffer from a sore mouth and diarrhea, sore tummy and loss of appetite, and you might require help with nutrition.
Once you come in for your transplant, you will receive chemo that can last up to 1 to 6 days. Once you complete your chemo, you'll have a rest day. Following your rest day, you'll have the reinfusion of your cells that can last up to 1 to 3 days, and the bags can take 10 to 15 minutes to go through. Following this, the isolation procedure will start. So you'll be in isolation until your counts recover.
And after the stem cells are given back, it takes about 2 weeks for them to grow. So during that time, basically your bone marrow doesn't work, and you have to be supported with transfusions of red cells and platelets where necessary. There's quite a high chance you will get an infection and have to receive antibiotics. But after about 2 weeks, the blood counts start to recover as the stem cells start to grow, and most people start to get better then, and after about 4 weeks are ready to go home.
For the vast majority of patients, it is a gradual recovery and it can take many months. You will be required to come to the clinic and be monitored initially every week. This is to make sure that your blood counts are recovering and whether you require any additional supplements or support. We will also assess how well the transplant has treated your disease through examination, blood tests and scanning.
You'll be reviewed by the dietitian at haematology clinic within the first few weeks of your discharge. Your dietary intake at home will be monitored, your weight will be closely observed, and if there is a need for ongoing nutritional support, that will continue.
You may feel weaker and more fatigued than normal when you get home. It's important to set small goals, don't overdo things initially, and just listen to your body. Usually people respond well to a little bit of activity, a little bit of rest, and just gradually get back into your normal lifestyle.